If you ask the Minnesota Department of Health, the state is in the midst of an influenza outbreak, and that's why city public health officials want you to arm yourself now.
Prevention is the best medicine.
Over 1,000 hospitalized and 27 reported deaths this season, all at the hands of a microscopic virus that could very well be prevented.
Last year was a pretty mild season, but this year is more of a typical season, and we do expect to see a certain number of people hospitalized, and some people do die from the flu, and that's why we want them to be immunized.
Each year, the flu vaccine is altered slightly to better counter strains of the virus. And if you ask Stanley,
it's never too late to get your vaccine, unless of course you're ill with the flu. But we do encourage people to get the vaccinations, and we do give them oftentimes into March and April.
Public health officials offer immunization clinics at the Public Health Center at 1900 West Old Shakopee Road, the first and third Tuesdays of each month. And because of increased attention, this flu season is making both supporters and opponents to the vaccine arm themselves from the virus.
We get our flu shot every year. We didn't get it till now because we were sick. He actually had the flu, and it's an awful thing to go through. So if it lessens the severity of the symptoms or it cuts the time that you are sick, that's why we get the flu shot.
First time.
First time?
First
What
time.
made you get it this year?
The wife. And just with having kids around too. Not bringing it home and having the potential for that to spread.
And don't take my word for it. Let's ask some residents if the immunization was painful.
Not really.
No, it didn't hurt.
I told you guys it doesn't hurt.
How bad was it?
It wasn't bad at all.
And after vaccination, be sure to follow these simple tips to keep yourself as healthy as possible.
People should be getting adequate rest, eating healthy, and of course washing their hands thoroughly so that they don't transmit germs from other areas to their face.